Hi, everyone. Welcome to 10 Things Parents Need to Know About Why We Immunize. We are so happy that you're here. Um, we thank you for spending your lunch hour with us. And we have many people registered from around the state. All 15 counties were represented through the registration. So we have a variety of medical assistants, school nurses, vaccine coordinators, and lots of different positions represented today. So welcome. We're glad you're here. The next slide. Please keep your microphone or phone on mute unless you are speaking. Feel free to use the chat box to ask questions. We will have quizzes throughout the training today, so you'll put your response into the chat box. Make sure you know where that is, and let us know if you're having any difficulties with the Zoom today. All of the handouts and videos will be available to you after the training, so don't feel like you need to write everything down. You'll have access to everything we talk about, including the recording from today's training. Next slide. TAPI is the Arizona Partnership for Immunization. We are the statewide vaccine coalition with over 500 members. Our mission is to foster community wellness, advocate for good public policy, and best immunization practices. And we are here to help you with any educational needs, printed materials, and support when you have any questions about vaccines or anything related. Next slide. Just a disclosure for our CEUs for this training, presenters have no financial interest or relationship with the commercial supporters of this educational activity or with the manufacturers of any commercial product and providers of the services discussed in this educational activity. Next slide. Today we have two great presenters. I'm going to introduce you to them. Wendy O'Donnell is the vaccine communicator at the Arizona Department of Health Services. She has been presenting this training for TAPI for 4 years-ish now. Thank you so much, Wendy, for coming back time and time again. Wendy is the parent of 3 kids, and she always loves talking about vaccines. That is why she is the vaccine communicator. And Wendy has a degree in public health and is a master's certified health education specialist. So there you go, Wendy. And then Blanca Martinez. Blanca's screen is coming on. She is TAPI's vaccine equity coordinator. She's been with TAPI for over 4 years. She's the mother and a grandma. We love that about her. And she's really passionate about keeping our communities healthy and focused on health equity. So welcome, Blanca. And I'll let you guys take it from there. Go ahead.
Great. Thanks, Laura. So we are going to go over the 10 science-centered evidence-based concepts about why parents should vaccinate their children. We hope to answer some common misconceptions and really make sure that you know the difference between facts and myths that we hear out there and provide you with credible vaccine online resources for parents and colleagues. This is a lot of information and it's hard to keep everything up in your brain. So we want to make sure you know where you can go to find reliable information so you don't have to have it memorized. We really want to make you feel more comfortable and knowledgeable about the benefits of vaccine, and really make sure that you can feel comfortable talking to parents about that. So we're going to start off with a quick video about what we've learned about vaccination.
I want to tell you about a
time in American history so that
it never repeats itself.
So it never repeats itself.
It was a harrowing time.
A heart-wrenching time.
I could hear my mother warn me, Seal, don't go out and play.
My family was ravaged.
Thousands and thousands died. I was scared.
So scared.
And then one day...
And then one day...
And then one day, there was hope.
Before vaccines, there were few ways to help protect against deadly illnesses. Diseases like measles,
Meningitis,
Diphtheria,
Hib,
whooping cough,
or polio, which killed my grandma's youngest son. Without vaccines, these threats can reemerge.
I'm here.
I'm here.
I'm here to tell my children to help protect their children.
Get your kids vaccinated and keep them on schedule.
I never want my grandchildren to see what I saw.
So, the real dilemma we have to face is that because of the effectiveness of vaccines over the last 50 to 75 years, people have forgotten about the diseases that the vaccines protect against. This is a phenomenon we call vaccine amnesia or public health amnesia, where a public health initiative such as vaccination becomes so successful that people forget how bad it was before. And we can start to see things like measles cases start popping up more and more across the country. So to start off with our 10 things, we really want you to know that there is a real risk for disease out there. This map shows measles cases from 2019. Measles was thought to be eradicated in 2000, but in 2014, new cases started popping up in unvaccinated communities. Still, 5 years later, we see that in 2019, all of the states in dark blue reported at least one case of measles. So if you really look and count the states, there were 28 states that experienced at least one measles case. That's more than half from a disease that we thought was completely gone and, we're not concerned about at all. But the problem is still there. These outbreaks are a direct effect of lower rates of immunization, and it shows that even when we have a single case of disease in 14 years, it doesn't mean that it's gone away, and we still need to keep up our continued immunization efforts because this is the only way that we can truly reduce the risk and get rid of these diseases. Epidemiological trends are showing that right now pertussis or whooping cough is beginning to recirculate. So you might have seen that in the news recently. Whooping cough cases are on the rise. I always like to say it's funny when I read these dates because I'm like, oh my goodness, that Disneyland outbreak of measles was I think it was the end of 2014, beginning of 2015, and I had just had my first baby. And then I had my second baby at the end of 2018, right into 2019. I'm like, every time I have a baby, there's a measles outbreak. So luckily for everyone, I'm not having any more babies. So hopefully there'll be no more measles outbreaks. Obviously that there is no correlation there, but always made me a little more nervous during those times. Next slide. And Arizona kids are especially at risk for some of these vaccine preventable diseases. ADHS requires every school to report once a year on the coverage levels of kids enrolled in school. This information is made available to the public and parents can be informed about coverage levels. This is on the ADHS website, so you can go and look at your specific school and see what the immunization coverage rates are there. We used to be at 95% coverage rate, but over the last 5 to 6 years, the level of protection has begun to drop as the number of vaccine exemptions, so the people who are, signing a form to get out of getting their kids vaccinated has begun to increase. Some schools have 40% coverage, which is extremely low and does not provide the herd immunity, which we will definitely talk about in a little bit, that is needed to protect the most vulnerable. Because of this, Arizona has been identified as a hotspot. And next slide. So in addition to that, our second thing we want you to know is that vaccine preventable diseases still exist. Diseases like measles, mumps, pertussis, again known as whooping cough, and pneumonia still infect and cause sickness in children across the U.S. Data shows that diseases still exist and are circulating. But if you've never experienced these, if it has not touched you personally, you may not really think about it. And you may believe that they are not around because they've never really had a personal effect on you. We're going to play a video of what it is sounds like when a baby, a young baby, has whooping cough. And I want to warn you, it's a very powerful video, and it's hard to listen to. But this is real life. This is a real baby. This is what really happens. So this is one of the reasons why it is so important. If you've never experienced this, it's it's awesome. But there are people out there who are experiencing it. So we want to play this video.
They're just kind of heavy. Uh-oh. There we go. Okay. It's okay. Okay, take a breath there, honey. Come on. Almost there. There we go. Oh my. It's okay. It's okay. Yeah. It's okay. Here. Yeah. It's okay. Yeah. Oh, yeah. It's okay, sweetie. Yeah. It's okay. Right. It's okay. It's okay. Yeah. It's okay. Yeah. I know. Yes. Oh, I know. It's okay.
So as you could hear and see, that was just really heartbreaking video. I couldn't imagine being that mom or even, being those nurses taking care of that baby. It's just, it's heartbreaking. There's really no other word for it. Um, so just to kind of bring us out of that, we're going to do a trivia question. So put the answer in the chat and then we will be picking a winner. So the US had cases of which of these vaccine preventable diseases in 2022? A, polio, B, measles, C, pertussis, D, none, or E, all of the above. I'll just give you guys a few minutes to put that in. And unfortunately, the answer to that is E. I know you don't really, in the 2020s, you don't really think polio is something that you're going to see, but that is something that there were cases of polio in the United States. It's strange, but that's what happens when those vaccination rates start to dip. Okay. So number 3, outbreaks are preventable when parents make the decision to vaccinate. The way we've traditionally prevented outbreaks was to keep 95% of the population immunized against the disease. If 95% of the people have immunity, the disease cannot spread through the community. It's also important that our youngest kids are immunized before entering school to protect the community around them. It's referred to as herd immunity, as I mentioned earlier, or also community immunity. We're attempting to keep our communities healthy, and the best way to do that is to vaccinate. I think it's easiest to think about community immunity in terms of a fence. So think about those of us with immunizations as planks in a fence. And together, if enough of us are immunized, surrounding one person who is not immunized because maybe they're too young or they're too medically fragile, there's, a few reasons why someone may not be able to get immunized. They're protected by us. They're protected by our slats in that fence. When a disease comes, it will hit the fence and kind of like go away, and we will create that protective barrier around that person. Outbreaks happen when there are too many holes in the fence. So there's not as many immunized people around that baby. Once it infects an unimmunized person, it puts all other unimmunized people at higher risk. There are certain reasons, like I mentioned, people are too young. There are people who are, immunocompromised who may not be able to get a vaccine. And then there are also people who just don't have as strong of an immune response to a vaccine. These are all the people that we are trying to protect by making sure that we ourselves are vaccinated. Next slide. And we know that vaccines work. The proof is in the pudding, as they say. You can see that many of these diseases that we have developed vaccines for are pretty much gone. They've drastically reduced. We want to make sure that you have the hard evidence that vaccines work. Once we have a vaccine against a disease, we've been able to eradicate, eliminate, or decrease the number of cases to almost 0% after the vaccine has been introduced. Vaccines are researched, monitored, followed in the community, tested, and updated. So it's not just like, okay, we made this, we're done, we're going to move on. The vaccines that we use today are not the same ones that were originally developed. Once a vaccine is approved for use, it is still constantly tested and researched for safety and efficiency. These diseases go away because vaccines work. And this is just kind of a staggering slide I love to show that according to the CDC, vaccines save an estimated 42,000 lives every year, which is 3 times more than seatbelts and child restraints combined. So think about that. Would you ever think of putting, not even a newborn, a 2-year-old in the back seat of a car in just like a regular seat, even just a regular seatbelt? It's just unheard of. You would never think to do that. And most of the time it would probably be okay. Maybe you're only driving a few miles away, and it's a short trip, but it only takes one incident for something to happen and for that child restraint to be worthwhile in saving your child's life. It only takes a single exposure to a disease you can't see for your child to become ill with one of these diseases. And the long-term effects on their health can be serious if, of course, that's one of the conditions that they got that they survived. So the advancements that immunizations have provided for children is just it's just staggering how successful and how much protection that they give us every year that we don't, again, it's one of those things that we don't really think about because it's been successful for so long, which we're very lucky to have. And then number 5, vaccine offers protection to us in different ways. So vaccines protect us from getting the actual disease, but newborns who are too young to get vaccinated are protected by their mother's vaccines. This is the first protection, but it begins to wear off around 2 months, which is really why then that's when the first round of immunizations start. Once the baby is about 2 months old to help kind of provide that, continue that protection. Some people can't get vaccines. They're too sick or have allergies, and these people are protected by the people who are around them getting vaccinated, just like the fence analogy. Um, and interestingly enough, only approximately 1 in a million children have a true allergic reaction to a vaccine. Sometimes people get swelling or a rash or start to feel sick, and they think that's an allergic reaction. But really, it's a true allergic reaction is severe and incredibly rare. A lot of times those kind of side effects that we feel after we get a shot is proof that our immune system is having a response to the vaccine that was introduced. So I try to frame it as a positive, like I know you feel kind of crummy. I After I got my flu and COVID vaccine several weeks ago, I was definitely not feeling great for a couple days afterwards. But I took that as a positive sign that my body was building an immune response to flu and COVID. So I'm very excited about that. I wanted to circle back up to the newborn immunity and getting that first the first protection from their mom. My third baby, I mentioned my one born in 2015, and then the end of 2018, I also had a baby born in 2021, which of course, I guess I'll take responsibility for measles, but I'm not taking responsibility for the COVID outbreak because that was well after it had started. But I was lucky enough to get vaccinated before he was born, and that really gave me some peace of mind coming in, bringing a baby into a newborn into a house at a time where COVID was, very, very. I mean, there was a lot of unknown still, and it was out there, and infection rates were high, and I had two other little kids, so it was a very nervous time, but I felt so proud that I was able to give him that first level of protection, so that I could just rest. There's so many things to worry about when you have a newborn, and that just gave me a little peace of mind during those first few months. Okay, and I'm going to pass it over to Blanca.
Thank you, Wendy. I keep forgetting to unmute, so I apologize. And I appreciate the patience. So this is Blanca from TAPI. We're going to move on to number 6. Vaccinate antibodies act as personal ninjas to protect from the actual disease. So after someone does get the actual disease, it takes up to several months to years for their immune system to fully recover, leaving them vulnerable to other illnesses and diseases. So it's better to get vaccinated. The vaccine tells your body that it needs to equip itself against this disease before you ever get exposed to it. And your body, in response, creates a bunch of antibodies that are like ninjas, just waiting to fight off the exposure. So next time you're sick, you're going to have this picture in your brain. Many years ago, when the vaccine was developed, they had a lot of more antigens in them to protect against the disease. But now the vaccines have been refined and updated to reduce the amount of antigens needed to protect against the disease. All of that research on safety and efficiency makes it possible for the vaccine developers to make sure that they're getting better and better all of the time. Okay, so I'll give you a little break here, but not really, because you're going to have another little trivia question. What vaccine is recommended during pregnancy? A, Tdap or pertussis, B, flu, C, COVID, D, B and C, or E, all of the above. And you can go ahead and put those responses in the chat for a prize, right, Laura?
Yes, that's correct.
Oh, I thought that was going to spark a lot more answers. Oh, there we go. Yay. We got a smart group here. So the answer was all of the above. So if you have any family members or friends that are asking, now you can let them know that. Going into number 7, babies get their first vaccine from their mom. There are new recommendations focused on pregnant mothers that during every pregnancy, the mother get a flu, pertussis, and COVID vaccine to protect her and her baby. It's important to talk to, for them to talk to their OB/GYN or to have the parents talk to the OB/GYN about when and where to get these important vaccines. Many people have all members of the household get vaccines to increase the protection for the newborn. Because these vaccines given in pregnancy are the baby's only line of defense until they can start getting vaccinated at 2 months. We'll talk more about the COVID vaccines in just a few minutes, but me, like Laura had mentioned, I am a grandmother of 1, 2, 3, 4, and 1 on the way. And in order for me to hold any of my grandkids, I have to have my flu shot and now COVID shot. So, and I truly 100% agree with that. So I'm glad that my family is on board with that too and believes that that's the way to go to be around a newborn. So. Okay, fight the flu. This is a good reminder that the best defense against the flu is the flu shot. Those precautions we talked about with COVID will also help to stop or reduce the spread of the flu. But without the vaccination, you can get a lot more sick if you are infected. And finally, if you do get the flu or believe you have flu-like symptoms, please talk to your doctor about being tested for the flu or COVID and the possibility of an antiviral therapy if it is the flu. I know you guys hear this a lot. I get the flu shot and I feel like it gave me the flu. However, it's important to know that the symptoms that they may be experiencing after getting the vaccine are actually a good thing. A low-grade fever, body aches, or even fatigue are all signs that the body has accepted the vaccine and is doing what it's supposed to do, developing immunity. Yay. Okay, time for another quiz. Trivia question. Can someone get a flu vaccine and the COVID vaccine at the same visit? Go ahead and type in your answer. All right, looks like A is the answer. Good job, you guys. That's awesome. Thank you for participating too. Makes it a lot more fun. All right, moving on to 8. Doctors and science support vaccinations. These organizations that you see here, like the Academy, American Academy of Pediatrics, American Academy of Family Physicians, American College Obstetricians and Gynecologists, American Nurses Association, and the CDC and March of Dimes are all organizations that support immunization as a strategy to keep kids healthy. So I'm sure some of you guys already have these bookmarked or go and use their resources a lot. That's a good one to have, good ones to have because with their education, knowledge, and experience is what you can rely on if you have any questions from the community or anybody that has questions that maybe you get stuck answering. These are great resources to have. And sometimes they have a lot of good resources to share as well. Okay, number 9. So off to school equals up to date on shots. Vaccines are required when children enter the childcare, preschool, or kindergarten to protect them and their classmates. It's important for children to be up to date on their shots because when they enter the classroom, they're in very close contact with other children, where diseases can spread rapidly. I used to be a preschool teacher, so there is no, there's not much of a 6 feet rule there. You don't want your child sick or bringing home a preventable disease that may be exposed to a younger sibling or an older adult that's perhaps under immunized. Each state has their own requirements in terms of school entry and vaccines. So try to get familiar with the guidelines in your state. But also the CDC website has information for all 50 states if you're unsure, or if you're traveling or you're taking a vacation, it's good to know what you're going to be up against. And finally, number 10, kids still need protection as they grow. We talk a lot about baby shots, but the same recommendations for vaccines continue throughout their life. We recommend we recommend following the CDC schedule for immunizations. The schedules are always updated and with new and improved vaccines as they come out. You can go to the CDC website or bookmark it, like I have mine, to review these recommendations for yourself. And for others, when people ask you, they even have printable vaccine schedules that are really easy to read for your reference. So my grandson is 2 months, so he needs to go in for his 2-month shots, and his mom is already saying, I'm not going. Dad can take him. But at least he's going, so that's good. Okay, next we're going to watch a very short video that talks about why vaccines work. It's a little long. Sorry, I didn't mean to say short. It's a little long. It's about 7 minutes. It's a great foundation for understanding why vaccines work. Think about some questions while you watch this video, and then we'll go through any common questions you may have after.
Aren't you glad you don't have scurvy? In 1747, in the first medical trial ever performed, Scottish physician James Lind found out that eating citrus fruits could cure scurvy. Now, today we know this works because citrus contains high levels of vitamin C. In fact, ascorbic acid, a common name for vitamin C, comes from the Latin for not scurvy. By issuing rations of lemon juice to sailors, the British Navy was able to pretty much eliminate the disease until the late 1800s, when polar explorers suddenly began to see scurvy again. The copper pots holding their lime juice had destroyed the vitamin C, but they were pretty confused. So despite James Lind's experiments 150 years before, citrus fruits became the enemy. And when Robert Falcon Scott set out to reach the South Pole in 1911, he carried the finest in canned meat products, biscuits, chocolate, tea, and zero vitamin C. A Norwegian team beat them to the pole by 5 weeks, and during their sad journey home, Scott and his team perished in a blizzard, sick and weak from what was probably scurvy. It had been so long since anyone had seen this disease, the British had forgotten how to prevent it. When we create such effective solutions, we can forget how serious the problems were. Thankfully, people today don't die of scurvy or polio. Since the introduction of Jonas Salk's polio vaccine in 1955, the disease has been nearly eradicated from the earth.
The thing to remember is that this is a continuous process.
Compare the 358 infections reported in 2014 to the 1940s, when 500,000 people per year were paralyzed or died from polio infections. Vaccines work. Our immune system is on constant alert against germy baddies, with millions of white blood cells each on the lookout for specific infections. When an immune cell meets its target, it replicates itself, and this clone army sends a barrage of protein weapons called antibodies to label the trash for cleanup. And after the infection is gone, so-called memory cells stick around, ready to mount a fast attack in case this germ shows up again. This is how we develop immunity, and it works pretty well, since we're all still alive. But even with all that, some super bad germs can take us out before our immune sentries have had time to call up their clone army. This is especially true for young children. Their immune systems are fresh out of basic training. Thankfully, we have vaccines, which are made of tiny pieces or weakened versions of viruses or bacteria. They let our immune system see what the bad guys look like and recruit those all-important memory cells before we ever have to actually see the real enemy. Thanks to vaccines, the US was able to eliminate measles in the year 2000. But in recent years, as more and more parents are refusing to vaccinate their children or are vaccinating them later than what doctors recommend, it's back. In most states, more than 90% of children are vaccinated, but that's not enough to keep a disease like measles at bay. In our episode about Ebola, we talked about a number called R0, the basic reproduction number for a disease, or the number of people infected by one person in a susceptible population. For Ebola, that number is low, but for measles, each sick person will infect up to 18 others. But luckily, vaccines can change that. The fraction of people who are vaccinated or immune can lower the reproduction number below 1, which means the disease is disappearing. 90% of unprotected people who come in contact with somebody who has measles, even just breathing the same air, will become infected. To control a super contagious virus like that, the vaccination rate has to be 95% or above. And right now the US is lagging behind, and measles is making a comeback. The Guardian put together a simulation of just how this so-called herd immunity works. When enough of a population is vaccinated, even if it's not 100%, the herd can protect the unprotected. With vaccine refusal on the rise, our herd immunity is breaking down. Preventable diseases like measles and whooping cough have become our scurvy. Most of us don't know anyone with polio, and I mean, measles. It's not that bad, right? Well, yes, it is that bad. Before the age of vaccines, millions of people were killed by diseases that today are just bad memories. Vaccines have let us develop a sort of generational amnesia. Today we expect our children to grow up healthy, and we're lucky that we don't appreciate just how dangerous these diseases are. Like science writer Seth Mnookin says, vaccines are victims of their own success. Because of stories like Andrew Wakefield's discredited study wrongly linking vaccines and autism, and the news media's obsession with pictures of crying, terrified children being poked with needles, people are nervous about vaccines. This anxiety isn't new, though. When Edward Jenner in 1798 saw that milkmaids didn't catch smallpox, well, he realized that because they'd been exposed to the similar cowpox disease, they were immune. And based on this, he developed an early smallpox vaccine by inoculating humans with the cow virus. In fact, the word vaccine itself has bovine origins. Still, as far back as 1802, critics were claiming that the smallpox inoculation would turn you into a cow. Vaccines don't come without risk. Nothing does. But on average, fewer than 1 in a million people will experience a dangerous reaction to common vaccines. And car accidents, playing outside, even walking will injure more children. Vaccines are asking us to do something altruistic, to make a choice to protect not only ourselves and our children, but also those around us. Author Eula Biss says that vaccines are one of the most empathetic things that we can do. A system that's based on people voluntarily using their bodies to protect other vulnerable people. And that's something I hope we don't forget. Now, I'm a doctor, but I'm not that kind of doctor. It's natural to have questions about vaccines, and you should have a conversation with your medical professional. They want the best for you and yours. I will give you one prescription though, and that's to subscribe so you can get a full dose of science every week. And if you want to read some amazing books about vaccines, check out Seth Mnookin's The Panic Virus and On Immunity by Eula Biss. Links in the description. Stay curious. Today we know that citrus fruits cure scurvy because they contain high levels of vitamins. Citrus fruits cure scurvy. Citrus fruits cure scurvy. That is a tongue twister. Today we know that citrus fruits cure scurvy. God. It is the worst sentence. Citrus fruits cure. Citrus fruits cure. Today we know citrus fruits. Today we know that citrus fruits cure scurvy. Today we know that citrus fruits. Now today we know that citrus fruits cure scurvy because.
Sorry, I'm over here cracking up and I forgot to unmute myself. That was so funny. And I tried it and I failed miserably as well. So Don't feel bad, dude. All
Yeah,
right,
that's
Wendy.
that's a tongue twister.
For
So
sure.
hopefully that video got you thinking about some questions and some common things that you hear around vaccines. But before we jump into that, I just want to touch on respiratory illness season. We are in the thick of it. Actually, this week is National Influenza Vaccination Week. So if you've not gotten your flu vaccine, it's not too late to get that. Um, but it's very important to keep kids healthy during respiratory illness season. Along with annual flu shots, there's the updated COVID-19 vaccine that's available for kids 6 months and up. And there's a new RSV vaccine for the littlest kids who are just born, so ages 0 to 18 months during RSV season. So that's a really new and exciting tool that we have to protect kids against RSV, which can be very dangerous for the littlest ones. Um, we saw record high cases of RSV last season in Arizona, so it's super important that the ones that are at highest risk get vaccinated and stay healthy this season. Next slide. So, COVID-19, flu, and RSV are common respiratory viruses that can cause significant amounts of disease, especially in the fall and the winter. Typically in Arizona, it seems like our cases start to pick up towards, December, January, February. So we lag a little bit, which just gives us more time to get those vaccines. So if you've not gotten them yet, it's definitely not too late to do that. It's just amazing now that we have these treatments, immunizations and treatments available that can help prevent some of the severe outcomes that we see from these viruses. Influenza, the flu, is a potentially fatal contagious respiratory illness caused by viruses that affect the nose, throat, and lungs. On average, 26.8 million Americans become infected with the flu every year. And we know that the flu vaccine is effective at saving and protecting lives and reduces the potential for serious illness. Everyone six months and up should get a flu shot. Every year, it's different every year, so it's an annual thing that you have to keep up with. These vaccines are administered by health professionals and are available at local public health departments, pharmacies, urgent care clinics, and community centers. My children's pediatrician does not carry the COVID-19 vaccine in their practice. So every year we pack up the kids and we go down to the Maricopa County Health Department and make an appointment for them. And since my husband and I are there too, there's 3 kids, so I can't take them by myself. It takes a whole team to do it. We went ahead and got ours at the same time as well. So all the family vaccinated one day. It was quick. I don't want to say easy because if you've ever tried to vaccinate 3 children, little kids, that's not really that easy. But they know the importance, and we got it done. So I was so thankful that we were able to do that. For those who are at highest risk of developing serious flu complication, it's especially important. And these groups are adults 65 and older, adults with certain chronic health conditions, such as asthma, heart disease, diabetes, and chronic kidney disease, pregnant people, and children younger than 5, but especially those who are younger than 2. So that's super important that those groups of people are getting the flu vaccine. Okay, and the next slide. And we have new immunizations to protect against severe RSV. So RSV is a common respiratory virus. Newborns and older adults are at a higher risk of developing severe RSV and needing hospitalization. Additionally, the RSV vaccine, when given during pregnancy, can pass immunity from the mother to the newborn during birth to help the newborn from developing severe RSV after birth. The CDC now recommends a single dose of RSV vaccine for adults age 75 and older. And then adults age 60 to 74 who are at an increased risk, similar to those for the flu, who have a heart or lung disease, those living in a nursing home or long-term care facility. And RSV vaccination is currently recommended as a one-time dose. If they've already received RSV vaccination, another dose is not recommended at this time. My mom got her RSV vaccine this year, so I'm thankful for that. And the next one is on COVID-19. The CDC recommends an updated COVID-19 vaccine during the 2024-25 season. And each year it's updated. So you want to make sure that just because you got one last year, or even, at the, let's say you got one in May of 2024, the one for this fall is different. So it's important to get that. I do want to say that I think one of our jobs is, and I'm not sure exactly what everybody on this call does, but you work with families. And I think it's in our nature. We are providing a service and we want to help people. And one of the ways we can do that is by protecting them by getting vaccines. So, if you're going into a family's home or if you're seeing kids in a center, it's just important that you are doing what you can to protect yourself from getting sick so that you are not in turn getting them sick. The other part of that is that if you're sick and unable to do your job, and of course, everybody needs time to take to themselves, and you need to do what you can do to take care of yourself if you are sick. But who's going to be doing your job if you aren't able to do it? So just two things, just to kind of keep in mind. It's important to keep yourself and not only your job, but taking care of your family and all of those things. So it's important to keep yourself protected and in by extension of that, keeping those families that you serve protected as well.
Good reminder, Wendy. Thank you. It is hard to take time off of work or you can't hit pause on life or being a mom or anything like that, but staying vaccinated is very helpful to keep it going. Okay. Now, we're going to talk about what are the hard to answer questions that you're hearing out in the field? Like Wendy said, we don't know what everybody does that's here today on this call, but if you have anything that keeps coming up and you're not entirely sure how to answer or would need help, go ahead and put that in the chat, and we can discuss some if there is any. If not, we're going to go over through some scenarios that might be very familiar to a lot of us. Okay. Hi. Okay, we're going to move on to a scenario. So a couple you are friends with tells you that they worry newer vaccines are not safe. They worry that the pharmaceutical companies make vaccines without testing them before they're given to kids and adults. What resources do you have available to help them with their concerns? Don't worry, you don't have to answer it. We're going to answer it, help you answer it. So before a new vaccine is ever given to people, extensive lab testing is done. That can take several years. Once testing in people begins, it can take up to several more years before clinical studies are completed and the vaccine is licensed. The FDA sets rules for the 3 phases of clinical trials to ensure that the safety of the volunteers. Researchers test vaccines with adults first. The FDA and the CDC closely monitor vaccine safety after public begins using the vaccine. The purpose of monitoring is to watch for adverse events, possible side effects. Monitoring a vaccine after it is licensed helps to ensure that possible risks associated with the vaccines are identified. So next, we're going to watch a video on exactly
the journey of your child's vaccine. A vaccine must be safe and effective. How a new vaccine is developed, approved, and manufactured. Vaccines begin the journey in the laboratory, where scientists work to figure out how best to protect against dangerous germs. Before a new vaccine is made available to the public, researchers usually must do years of lab tests on the vaccine. If lab results look promising and the vaccine appears to be both safe and effective, volunteers will be enrolled to get the vaccines in a series of carefully monitored clinical trials. The manufacturer usually conducts 3 phases of clinical trials. Each phase is designed to gather more information about the vaccine safety and how well it works. These trials can take years to complete. During phase 1, about 20 to 100 healthy adults get the vaccine. Researchers track how well the vaccine works, whether it's safe, what is the correct dose for disease protection, and what possible serious side effects may occur. In phase 2, hundreds of volunteers participate. This is when experts learn more about the possible short-term side effects and how the volunteers' immune systems are responding. Phase 3 trials are the most informative, with results from hundreds or even thousands of volunteers. In these trials, vaccinated volunteers are compared with volunteers who receive another vaccine or no vaccine. These results give researchers a better idea of how well the vaccine works and if there are possible side effects they should expect. The Food and Drug Administration, or FDA, along with the Vaccines and Related Biological Products Advisory Committee, review all of the data the researchers have gathered throughout the trials and decide whether or not to license the vaccine. Once licensed, vaccines are made in batches called lots. Manufacturers test the lots to make sure the vaccines are safe, pure, and potent. The FDA reviews the safety and quality of each lot before it is released. The FDA inspects manufacturing facilities on a regular basis to ensure quality and safety. How a vaccine is added to the U.S. recommended immunization schedule. Once the FDA licenses a vaccine, CDC brings together the members of the Advisory Committee on Immunization Practices, or ACIP, to review all of the research available on the licensed vaccine. The members of the ACIP include world-renowned vaccine and disease experts from groups like the American Academy of Pediatrics and the American Academy of Family Physicians, CDC, and other government agencies. These experts look at how well the vaccine works and whether it's safe when given to different age groups. They also weigh the seriousness of the disease the vaccine prevents and figure out how many children would get sick if they did not get vaccinated. The experts then decide if they should recommend that vaccine be added to the U.S. recommended immunization schedule. If the CDC approves the experts' recommendations, the vaccine officially becomes part of the schedule, and soon it will be available at your healthcare provider's office. How a vaccine's safety continues to be monitored. Once children start getting the vaccine, the FDA and CDC continue to watch for possible side effects. Reactions that happen after a vaccination get reported to the Vaccine Adverse Events Reporting System, or VAERS. Anyone can submit a report to VAERS, including parents, caregivers, patients, doctors, and nurses. However, the reactions that are reported may or may not be caused by the vaccines. They may require further investigation. Researchers at FDA and CDC analyze the VAERS reports and look for any trends that may be happening. FDA and CDC also use other vaccine safety systems. The Vaccine Safety Data Link, or VSD, and the Post-Licensure Rapid Immunization Safety Monitoring System, or PRISM, actively monitor new vaccines to obtain additional information about their safety. VSD has access to healthcare information for over 24 million people. PRISM can analyze healthcare information from over 190 million people. CDC also uses the Clinical Immunization Safety Assessment Project, or CISA, to study vaccine safety. CISA is a collaboration between CDC and 7 medical research centers. CISA vaccine safety experts conduct individual case reviews and clinical research studies about vaccine safety. Recommendations for using the vaccine may change if the vaccine's risks are found to be greater than its benefits. The end goal is always the same: to safely and effectively protect children, families, and communities against potentially serious diseases. For more information, please visit cdc.gov/vaccines or cdc.gov/vaccine-safety or fda.gov/CBER.
Okay. I know that was a lot of information. As you can see, there are several agencies watching out for side effects and safety concerns with the vaccines. It's not just the CDC and the FDA. There are several other organizations making vaccine safety their top priority as well. So when you're talking to parents, just reassure them that the vaccines are safe and effective. I know it's a little challenging at times, but don't forget, if you have any questions, you can use a chat. This is a safe place. You're in a safe group.
Thanks, Blanca.
You're welcome.
So the next myth or, kind of concern that we hear a lot is that they're getting too many. So mom and dad both think vaccines are good, but the babies get too many at one visit and their immune systems are still too new for so many. They plan to delay some of their vaccines and only get 2 at each visit. So if a family came to you with this question or with this concern, how would you respond to that? And if you want to, I think they have the ability to unmute themselves. Yes. So you can come off mute or you can put it in the chat if you don't feel comfortable doing that. But I really want to hear what how you would respond to that. We get some interesting information. I always learn something in this section.
Yes, people can unmute if they would like to, or put it in the chat.
Okay, great. Is this something that you all hear? You can say yes or no, or...
Hi, good afternoon.
Hi.
So I'm the health tech from Longview Elementary.
Oh, awesome.
So pretty much what I'm understanding is that if a parent would say that they plan to delay some of the vaccines, I basically would inform them that there's kind of like it's like an immunization schedule recommended by the CDC as to when those vaccines are supposed to be given, and also let them know that, and from what I was told, that if they don't get them in those time frames, like 2, 4, 6 to 18 months, for example, that some of those would, even though they're documented and given, that if they're not given when they're supposed to be given, they will have to restart the series.
That is, I love that you're referring back to the CDC and because that is the way that the order that the vaccines are given was it's not just random. They've studied it to say, okay, your body has the best immune response at this age, at this dose and all of that. So that's really smart because there is a reason to it. It's not just like, oh, just throw these shots together and give them to this baby. It's very specific, and it's tested, and it's most effective that way. So that's, I love that you refer back to that. We never want, of course, even if it's late, it's better than not at all. So that's good. I don't think a series has to be restarted. Um, but the quicker it can be done and the more precise that it is, the more the closer to the actual schedule that it is, that means the sooner the baby has protection. So that's a great response, for sure, for sure.
Okay.
Another well, thank you for sharing. It's great to hear from school staff. I'm sure you have to deal with a lot.
No, yeah, thank you.
Yeah, she gets a prize just for working out of school.
Woo! Yeah, seriously. I know that, yeah.
It's hard.
Yeah.
I do see a lot of little ones. I think I'm like their little mini urgent care.
Aw. My 5-year-old, she's in kindergarten. She loves going to the nurse. And the nurse is like, "Oh, hello, Cameron." And
Oh yeah.
I need a
Yeah.
Band-Aid. It's just like it's for every little thing. And I'm just like, oh my gosh, but they're keeping her happy, so they haven't
Yeah.
complained about her yet. So
Yeah, they're awesome. They're their own little people for sure.
for sure.
I'm sure you have a great fan club, Sonia.
Yes.
Yeah, they're really cool. I had one today I have to share. She came in, a kid hit her in the chest and she said he broke her heart. So she needed it fixed.
That's adorable.
Oh my gosh, that's so cute.
Yeah, it was adorable.
Awesome. Thanks for sharing.
So here's some other some other things that you can use. Childhood vaccines are not an extra burden on the immune system, even for babies. Babies are exposed to hundreds of viruses and bacteria during normal activities like eating and playing. Of course, babies are putting everything in their mouth, so that they're not completely protected from viruses and bacteria just by nature of being a baby. And even though kids receive more vaccines than 40 years ago, overall they're being exposed to fewer antigens, as we talked about before, because the science is getting better and better. So they're protected against more diseases with fewer antigens. I also think that, when you spread them out like that, we have great combination vaccines. So it's like you can be protected from 3 diseases with one shot. But if you're going to spread them out, for my children anyway, would be a lot more traumatic because then they're getting poked a lot more times. I wish we could get a flu COVID combo. That would be amazing for me. But we also have, of course, the wonderful Dr. Offit, who has a video that will give us, of course, more information.
Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center here at the Children's Hospital of Philadelphia. The most common question that we get asked here at the center is, do babies get too many vaccines? It's an understandable question. In the first few years of life, babies get vaccines to prevent 14 different infections. That can mean as many as 27 inoculations during that first few years of life. It can mean as many as 6 shots at one time. And I don't care how smart you are about viruses or immunology, it's hard to watch your baby go through that. So the question is it too many? Well, so let's take a step back. When babies are in the womb, they're in a sterile environment. When they enter the birth canal and the world, they're not. And very quickly, they have living on the surface of their body trillions of bacteria. I'm not just trying to sound like Carl Sagan here, literally trillions of bacteria. You actually have roughly 100 trillion bacteria on the surface of your body. That's more than you have cells in your body. Now, each single bacterium has between 2,000 and 6,000 immunological components. Now, by immunological component, what I mean is the complex sugar that sits on the outside of the bacteria, so-called polysaccharide, or the proteins that make up the bacteria. Viruses also have proteins, and those are considered also immunological components. Now, if you add up all the immunological components that are currently contained in vaccines, it adds up to about 160. So think about that, 160 immunological components which consist of viral proteins, bacterial proteins, or bacterial polysaccharides, as compared to the trillions of bacteria, each bacterium of which contains 2,000 to 6,000 immunological components. So I think literally what you are exposed to in vaccines is a drop in the ocean compared to what you're exposed to in daily life. Frankly, I think a cut on your knee is a greater challenge to your immune system than our vaccines. I think the common cold, which can reproduce itself thousands of times in your body, is a greater challenge to your immune system than vaccines. So I think the short answer to the question, can babies tolerate so many vaccines given in the first few years of life, is yes. Because frankly, they encounter far more in their environment than they're ever going to encounter in vaccines. Thank you.
Sorry, I'm trying to find my cursor, Wendy. Okay, so moving on to, this is a big one that we hear a lot. I also go out into the community and do a lot of events, and this is one that comes up very often. So a mom of a 13-month-old toddler is sharing in her mom's group that her baby is not the same as she was before her MMR shot. She's worried that the shot caused harm and wants to warn others about vaccines and autism. What resources do you have prepared to be able to help with this concern out there? As we know, this is a misconception that has been shared widely, but there is no proof that vaccines can cause autism. Unfortunately, we still hear this myth, and you will hear this when talking to parents. We have some resources available for you that will help you talk to this concern. So here we go.
Just by it's yes or no in the chat. Is this something that you all have heard? I feel like this is the most common misconception out there. And when you hear when people say things, yes.
Yes.
Yes. And it's so crazy because the flawed study that was done so long ago, and it's just really stuck around, and the anti-vaxxers use it and just really, I don't know, I think there's an emotional pull to it, and then people are really, they get really wrapped up in it, and it's been so hard to beat, and it's difficult.
Absolutely. It is important to note that the signs of autism are typically picked up about the same age as the MMR is given. So just because it is happening at the same time doesn't mean the vaccine gave the child autism. There have been many multiple studies in this claim, just like Wendy said, and there has been no connection that's been proven. So yeah, we hear this with adults too, and oh, I just got my COVID vaccine and now I have this hair growing out of my chin. Or it could be that it was just that time for the hair to come out, So these are things that we hear very often.
Right. Just before you, at the immunization conference, I think I saw a group of, I think MAs wearing a shirt, and it says like vaccines cause adults, which I love because it's like, yes, absolutely. Like, you got the vaccine and you were able to live into adulthood.
Absolutely. I've seen that before. It's cute. All right, let's hear from Dr. Offit again.
Hi, my name is Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. I think probably one of the most common concerns parents have about vaccines is, do they cause autism? Certainly very easy to find that contention on the internet and in chat rooms, so it can be scary. And I think from the parent standpoint, they argue this: look, my child was fine, they got a vaccine, now they've developed signs and symptoms of autism. Could the vaccine have done it? Well, the good news is that's an answerable question. And it's really been in three different areas that this issue has been raised. One is the concern that the combination of measles, mumps, rubella, or MMR vaccine caused autism. The second is the notion that there was an ethyl mercury containing preservative that was in a number of vaccines. Now it's only in some multi-dose vials of influenza vaccine called thimerosal. And then the third sort of concern is that children are just getting too many vaccines too soon, that that's somehow weakening or overwhelming or perturbing their immune system. Well, these are studyable questions. You can answer this question. So, for example, in the case of measles, mumps, and rubella, there now have been 18 studies done in 7 different countries on 3 different continents involving hundreds of thousands of children who either did or didn't get the MMR vaccine, making sure that those two groups are otherwise similar with regard to their healthcare seeking behavior, their socioeconomic background, their medical background. And again and again and again, those studies all found the same thing, that the MMR vaccine did not cause autism, and that's been true also for these other two concerns. The good news is I think most parents get this. I think most parents believe these studies because a recent study by the Autism Science Foundation found that about 85% of parents of children with autism now are comfortable that vaccines weren't the cause. Thank you.
Thank you, Dr. Offit. Okay.
The next one that we hear about are measles parties. So this is a scenario. A family you're working with just attended a chickenpox party so that their kids have a chance to get the disease and boost their immune system. They want to know if chickenpox and measles parties are a good idea. This is an interesting concept. I was born in the 80s, right before the chickenpox vaccine was available. So my brother and I did go to a chickenpox party. I have a little scar on my face because of it. So yeah, how many of you have, was that, I mean, and I'm not saying that, you know, our parents did what they needed to do back then because there was really no other option. So is that something that you all experienced? Or if you're a grandparent, did you do this with your children? No judgment, of course. We also heard about at the beginning of COVID when people would have COVID parties, and which was just such a tragic thing because people were dying from them. They thought once you got COVID, you weren't going to get it again. So they all got together and of course, now we know that that is not the case, but we did not have that knowledge back then. So many unknowns. So the truth is, infection actually does cause better immunity than vaccination. But it comes with a much higher price. So that can be paralysis, permanent brain damage, liver cirrhosis or cancer, deafness, blindness, pneumonia, and death, of course, which is the most severe outcome out there. So we will let, again, Dr. Offit explain this.
Hi, my name's Paul Offit. I'm talking to you today from the Vaccine Education Center at the Children's Hospital of Philadelphia. One question parents reasonably ask is, isn't natural infection better than immunization? Well, I mean, I'm a man in my 60s. I was a child in the 1950s. I had measles. When I had measles, I developed an antibody response that is probably 3-fold greater than what children will get if they get a vaccine. But what I didn't have to suffer by being naturally infected was I didn't get pneumonia, which could have caused me to be hospitalized. I didn't get encephalitis or infection of the brain, and I didn't die. I mean, every year in the 1950s, everyone got measles by the time they were 9 years of age. That meant that 3 to 4 million people every year would get measles. About 48,000 would be hospitalized with pneumonia or encephalitis, and 500 would die. Fortunately, I wasn't one of those people, but I could have been. So the better question is natural infection better than immunization? The better question is immunization good enough? Can immunization induce an immune response that's good enough to prevent and arguably eliminate these diseases? Well, we have the answer for measles. When we had a second dose measles vaccine recommendation in 1991, that meant that all children in this country were recommended to receive a measles vaccine when they were 12 to 15 months of age, and again at 4 to 6 years of age. With that, we eliminated measles from the United States. Eliminated it by the year 2000. The only reason that it's come back recently is that a critical number of parents have chosen not to vaccinate their children. So I think the good news about the measles vaccine is it induces an immune response that's good enough to have eliminated that virus from this country without asking children or having children risk the severe and occasionally fatal effects of a natural measles infection. Thank you.
So I have one last story before we pass it along to Laura. I know we talked about school and kids are in such close they're so close together, especially Blanca said she was a preschool teacher. Those kids have zero concept of personal space. But I got a message from my daughter's kindergarten teacher just 2 days ago. And she said, a little boy came up and licked your daughter's ear today. She's like, I just wanted to let you know, I'm keeping an eye on him. I don't know what that was about. Kids are weird. So I was just like, okay. I mean, kids are weird and they have no concept of personal space. So that it didn't seem to bother her because I didn't even know about it. She didn't say anything to me. So, and things have been fine since then. But I was like, what a weird story. And just shows you how easily things can pass, and just the concept of personal space in a 5-year-old is non-existent. So
that's hilarious, Wendy.
Can you imagine? Like, what is going on?
I love it. Okay, so we've been through the 10 things. We've talked about different scenarios you may find, but we really want to make sure that you have reliable resources of where you can go for more information. Make sure that the resources you use are science and evidence-based. We have a list here of some different websites like the American Academy of Pediatrics, the Centers for Disease Control and Prevention, the CDC. Lots of different resources are available. There's also apps or books, videos, all of those. Next slide. We saw a few videos today from the Children's Hospital of Philadelphia. Once again, these videos and links and handouts are all available on our website. I'll be emailing you the links to those. But here is the Vaccine Education Center at CHOP is such a helpful resource. If you have a really tough question that you're getting and you're not sure how to answer it, they probably do have a video or a handout or something like that that you can share with a parent or a friend or family member that is asking you that question. And then, of course, we always recommend the CDC as well. The next slide. Tappy designed this handout on the left, which is kind of like a shortened little paper you can keep in your office, where it has some common questions and then how to answer them. So that is a really helpful handout if you would like that. And then again, of course, the TAPI website is whyimmunize.org. We just went through a website redesign, so we made things even more accessible and easier to find, as well as updating information. We have lots of different handouts. Please go to the next slide. Here are the handouts. So we have flyers on all different subjects regarding immunization. We have, if you work in a preschool childcare center, there is immunization schedules. We also have this one on the bottom right. Lots of people like to hang this up in exam rooms or school health offices. Just a reminder to cover your cough, stay home when you're sick, all of that. The flyer in the middle has a vaccine schedule on the back of that for all ages. That's super helpful. There's also flyers about pregnancy, and then specific vaccines as well. We also have stickers and buttons. All of these resources are available on our website for you to order. You can either download them and print them off or share them electronically. You can also order them from us, and those are free, and we'll mail them to you. So please use our resources. I love talking about the Vaccines for Children's program. It's one of my favorite things. It is a nationally funded program that helps ensure that all children have a better chance of getting the recommended vaccines. And so, if you have insurance and it does not cover vaccination, if you don't have insurance and you don't have a way to pay for vaccination, money really should not be an obstacle to making sure that yourself or your children or your students or your patients have the option to get vaccinated. So there are many different vaccine locations available, VFC locations available for you. You can go to that website on the bottom. Next slide. Thank you so much to our presenters, Wendy and Blanca. You guys did an awesome job. I'm going to put a link to a survey in the chat if you want to fill that out, and then we will draw some prize winners. If you want a prize through the trivia questions, I contacted you privately, so make sure you respond to that. And we have just a few more minutes, so does anyone have any questions? Here's the link to the survey. We also have CEUs available. If you want to go one more slide forward. Thank you. We have CEUs available for medical assistant, social worker, registered nurse, certified health education specialist, or a certificate of completion. If you would like any of those, I will put that link in the chat. You can go back one slide. Thank you so much for attending today. Hopefully you learned something. Sonia, we'd love to give you a certificate for that. So make sure to fill out that form, and we'll stay on for about 5 more minutes or so. If you want to unmute or type any questions into the chat, we'd be happy to answer them.
Thank you, everyone.
Thank you.
Trying to think if I have any other weird stories about I have so many stories about my kindergartner, but
I'm gonna say, I'm sure you do, Andy.
I have a preschooler this year. So she's 3, and she has brought home every sickness since school started in August. She has been sick many times. Right now we're doing good. So let's hope we can get through the holidays without any other sicknesses.
Sharing is caring.
Yes.
They care a lot.
Yes, they do.
Thank you all for joining us today, spending your lunchtime with us.
Hello.
Hi.
Hi, I'm sorry, I'm unable to join the chat, but I'm calling in, and I wanted to be added to for the certificate as well. My name is Starla Garcia.
Starla, did you register?
Yeah.
Okay, perfect. I will email out these links to your email you registered with, so you can get them there as well and fill out the evaluations that way.
Thank you so much.
You're welcome.
Miss Laura?
Yeah.
Is this training also posted for anyone that missed it on our website?
Yes, the recording will be posted if anyone was not able to come.
Okay, awesome.
Leona, you are a community health worker. That is awesome. Typically, it depends on what certification body you use for that. It depends on what they will accept. So get that certificate of completion, and then and then you can submit for your CEUs for that to your community health worker board. Awesome, Amber. And Amber is a health services assistant. I'm guessing that's what HSA is at a school, and a CNA. That is awesome. We do a training similar to this for school nurses, and we talk a lot about the requirements for school nursing and all of these 10 things as well. So we'll be holding one of those trainings in February. I'm going to write down your information and email it to you. We'd love to have you join.
Happy holidays, everybody.
Yes, stay healthy.
Yeah, there's nothing worse than going to family functions where all this yummy food that you've been waiting for all year and you're sick. Not fun.
Sonia says the survey's not working. I'm not sure what's going on. I'll check it and then I will email out the links as well. So, um, watch for that, Sonia. Okay, I think that wraps it up. Everyone have a great rest of the day. Thank you for coming. And Lisa, it's asking for a code. Okay, I will check those surveys and see what's going on. And then in the thank you email for attending today, I'll make sure those are working well.
Thank you, everybody.
Thanks, everyone.
Bye.